Good morning, everyone. Happy New Year's Eve. Good morning. We'll get started in just a moment. Hopefully this will be a little bit shorter edition today. Okay, let's go ahead and get started. Good morning. I'm Sunnyvale Mayor Larry Klein. Thanks for joining me again this week. I hope everyone's enjoying their holiday break. And happy New Year's Eve. Today we're closing a very difficult year. We can all give a happy goodbye to 2020 and hope that 2021 will be a lot better. This is my 42nd installment of my weekly virtual office hour address. People continue to say they appreciate these live stream addresses and hearing from their mayor. So I'll continue to do these through the end of shelter in place and a lot longer. This Facebook live stream event is really great because it allows me to give you some updates, answer some of your questions, and of course, provide some words of encouragement. Thanks for allowing me to continue to represent you and work for Sunnyvale as much as I can. So I hope everyone's doing well, staying healthy. Please remember to take care of yourself, both physically and mentally. These are difficult times for many of us. There's this general fatigue of staying at home. A lot of us were hoping to be away for the holidays. It's been very difficult, holiday season to be separated from friends and family during normally a very festive time. So please stay home, don't travel, and keep following the county health orders. So you can do your part to stop the spread of the virus. Continue to wash your hands, don't touch your face. Practice safe social distancing when you're out, reduce the number of people that you come in contact with, and of course, remember to wear your mask. It does help, it's mandatory, and it does really make a difference at the end of the day. And of course, get your flu shot. It's flu season, and we'll be talking about vaccines and vaccinations a little bit later, but we continue to see a surge in cases here in Santa Clara County. Remember, you could be a carrier or someone you could meet. could be a carrier and have no symptoms, be asymptomatic, and wearing a mask is one of the best things that you can do in order to help prevent the spread of COVID-19. So we're now 290 days after the March 16th county health order started all this, started the shelter in place, and it was an attempt to slow the spread of COVID-19. We did well for a while, as we saw an outbreak of cases, and then it kind of leveled off and dropped off over the summer. But once we hit the fall, and especially for the last month or two, as soon as the cold weather really started hitting, we've seen a dramatic increase in the number of cases. So do what you can to stop that spread. Since that declaration, a lot's happened. A lot happens almost every day. I have press conferences to watch, seminars to attend, and conference calls to confer and advocate on your behalf. So it's difficult time for many, and hopefully we see that light at the end of the tunnel. We will hopefully have a much brighter 2021. So but it's going to be a slog to get there at this point. So let's go ahead and talk about what's happened at the federal, state, county, and city level over the last week or so. Last Monday at a federal level, the new CARES package was finally approved, at least from a congressional standpoint. And, it was a CARES package and an emergency budget package to keep the government from shutting down. And it had been more than about 8 months since the COVID-19 relief package, the CARES Act, was signed by the president. And there have been lots of proposals and negotiations, but nothing had gotten done. And finally, beginning of last week, that was signed. And it was about a $2.3 trillion spending package. And it was a long document, about 5,600 pages long. But it was, about $900 billion in pandemic relief. But I was surprised and a little saddened that we didn't get any city support, ultimately. And it was going to the residents that really needed it. So it was $600 stimulus checks to those making, less than $75,000 a year. It's $600 per child for eligible families, $300 for weekly unemployment benefits that were set to expire, and then about $25 billion in rental assistance. So it was good from a lot of ways, but it had no support for cities. And then, of course, President Trump threatened to veto unless the $600 was raised to $2,000. So ultimately, on Sunday, Trump signed the final package and funded the government until September. Congress has now taken up the continued call for local support and more stimulus checks for those that are in need. We'll see how that goes, but right now that's actually been stalled. That need for aid has been stalled. But people have started to receive their $600 checks, and so this ongoing debate on whether or not there's additional assistance will continue, at least for the next month or two. But at least for now, people are getting some additional assistance, so that's good for those that are most in need. And then last Monday, Governor Newsom had his weekly press conference and talked about that, about 98% of Californians were currently under that 3-week regional stay-at-home order because of ICU availability. And, that was a week ago, and things have gotten really no better in the week since. From a regional standpoint, from a state standpoint, the governor said it's most likely that because of those current trends, they'll have to extend those stay at home orders. So, and that's what basically happened, earlier this week. And he also said that they won't be lifting those stay-at-home orders until all 5 regions are above 15%. So we'll see whether or not the governor stays with that plan. But currently that is the plan. And with the with the ICU availability, especially in Southern California, that will be extended. All those regional stay-at-home orders that were set to expire finally, or will be extended at least for another few weeks, if not longer. Last Tuesday, Governor Newsom announced his replacement for Senator Harris as she moves on to her next role as vice president. And so the governor chose Secretary of State Alex Padilla to fill the Senate seat that now soon to be Vice President Harris will be exiting. And then and so that was pretty historic, and that was the first Latino state senator to represent our state in this role. So that's really impressive. And then he also chose the Democratic Assembly member Shirley Weber to fill the Secretary of State position that Alex Padilla had just vacated. So it's and it's not an easy sort of thing for the governor to deal with. He can't make everyone happy, and so definitely there's been a lot of that functionality from his standpoint of trying to gain. Trying to make sure that he appoints good people to the position, and then trying to deal with all the different lobbying groups that are saying choose their best candidate. So but I'm happy to see that that's moving forward. Last Tuesday night, from a council standpoint, so city council met, and it was a special meeting. Our last meeting was supposed to happen about 2 weeks ago, but we ended up having to call up a special meeting, and we did two things that night. We considered an emergency ordinance to delay the implementation for the increase in minimum wage. So it was set January 1st. The minimum wage was set to be raised from $16.05 to $16.30, and several council members had agendized that we should discuss whether or not to delay that, because it's very difficult for lots of businesses, especially those small businesses right now. And Sunnyvale and Mountain View were really forward thinking a few years ago, and there was a county-wide effort to increase the minimum wage. A lot of cities put increases to go to $15, and then CPI increases that went in place on a yearly basis after that. And Sunnyvale and Mountain View were the two to lead that way. And so, but because of COVID and basically closing al fresco dining, so I think the restaurant owners were the biggest groups to basically lobby council to say we should take another look at delaying that. Of course, restaurants are only some of those businesses that are employing minimum wage workers. There's janitorial workers, there's cafeteria workers, there's lots of workers out there, big and small companies, and lots of people spoke for or and against that delay. And in many ways, it was a lose-lose situation. We want to help our working residents, especially those that are working at minimum wage, and we also want to help our small businesses that are really the lifeblood of our community. When council approved that yearly increase, it was really a contract with our residents and our employers that this is the way business is done in Sunnyvale moving forward. So ultimately, from a council standpoint, we unanimously decided not to put that delay in. So go ahead and increase that minimum wage. And it makes sense, because only a certain percentage of those minimum wage workers are working at restaurants, and the other larger mid-sized companies are still employing their workers. And so at the end of the day, it's 25 cents a day per worker. 25 cents an hour per worker. But at the end of it's difficult. Please, as I've always said, support your local businesses. For the restaurants, do takeout, tip well, do whatever you can to support those businesses that are really the lifeblood of our community. And it's from a per worker standpoint, we're talking about $40 to $50 a month increase. So if you are doing your part, if you can, support going out and supporting those businesses, it does make a difference. And then the other thing that we did was we approved the latest public safety officer's contract, and so that was a contract negotiation that went on for the majority of the year. The contract was set to expire today, December 31st, and it basically council approved a final negotiated contract a few weeks ago. It had to go in front of their union. They had to vote on it, and then it had to come back to council for final ratification. So there were some final steps, and we wanted to get it done before the end of the year, before the previous contract ran out. So that was, a fairly simple thing to do from that standpoint. But contract negotiations are always going on every few years from that standpoint. And then, so that was Tuesday night, and then last Thursday, county officials had a big press conference really begging people not to travel for the holidays. And, because the continued number of COVID cases and the number of deaths in our community because of COVID, even though it's, this continued message is being put out there, we were still seeing a increase in the number of flights and the travel outside of the Bay Area. So, personally, we canceled our holiday plans about a month ago. I was really looking forward to getting out of California for the holidays. We'd already had a plan to go to Hawaii earlier in the fall that we canceled, and then we were hoping to get away for the Christmas holiday break. Since since on council you don't get that many longer period breaks. By charter we have 2 meetings every month, and so it's difficult sometimes to fit in those breaks. And so I was hoping to get away, much like many others, and from that standpoint, I'm happy that to stay at home, to stay safe, and set a good example for everyone. So I hope everyone else is staying safe and doing their part to stop the spread of the virus. Friday, of course, was a week ago was Christmas. So Merry Christmas for those of you celebrating. I hope people at least were able to celebrate remotely. I joined several Zoom meetups to celebrate the Christmas holiday. And if you go around the city, I think I've seen more holiday displays and holiday lights than we've ever seen before. So people were looking at ways to celebrate the holiday at home. And from my standpoint, this was the first Christmas we'd spent actually in Sunnyvale in probably 6 or 7 years, if I remember. So it's good to actually be here for the holiday for once. And then this week, on Monday, Governor Newsom continued his standard weekly conference for Mondays. He covered his standard fare on ICU availability, and from a regional standpoint, the Bay Area still not doing well, but we were on Monday, we're at 9.5% ICU availability. Greater Sacramento had moved up to about 16.6%. So it had actually had a little bit of additional ICU availability. Northern California is still at 29%, but Southern California, the San Joaquin Valley are still at 0% availability for ICU beds. So and projections that stay-at-home order would continue because of that ICU availability was expected. The Santa Clara order is set to expire on January 8th because it was all based upon when you hit 15%, and then at least for 3 weeks, 15%, drop below 15% ICU availability, and then for 3 weeks you would actually be in that stay-at-home order. Ours is set to expire January 8th. At this point, it will most likely be extended. The governor also talked about sending assistance to LA County to help with load leveling. So they've done some evaluation of the issues in their hospital system down there and their ICU bed availability. And the biggest thing is greater coordination among the different hospitals. That's critical when some hospitals are sitting at 110 or 120% of capacity. So they have people in waiting in aisles and doorways, and then others that are sitting at 80%, 90%. So it's being able to level that load amongst the different hospitals. So LA County is getting additional assistance from the state. And then from a vaccine standpoint, the governor talked about the Moderna vaccine arriving later this week. So I think it arrives today or tomorrow. And that means that we'll get a total of about 1.76 million doses by the end of the year. So by the end of the year, we'll have had at least almost 2 million doses for California between the Pfizer and the Moderna vaccine. And then the governor also announced a new pharmacy partnership between CVS and Walgreens. So they will now start assisting with vaccine distribution. So in order to kind of reduce the need and effect on existing staff, so a lot of the hospitals are already overburdened. So trying to also deal with doing vaccinations there wasn't seen as a possibility. And so with working with the pharmacies, which are spread around our community, it only made sense that having CVS and Walgreens also providing that capability of giving vaccines makes a lot of sense. And then looking beyond, so the different phases of distribution. Phase 1A was, healthcare workers, for frontline responders, people at senior care facilities. And then there's been a lot of discussions on the different tiers for 1B workers. And so tier 1, and this is kind of what the governor was announcing, tier 1 is those people over 75. Tier 2 would be workers in education, childcare, food, and agriculture. Tier 2 would be 60 people over 65 with underlying medical conditions. And then you're getting into other things like transportation, and finally, transportation, then agricultural workers, other important workers, but kind of providing additional services. And then phase 1C would be finally those people 14 to 64 with underlying medical conditions. So, it's building, setting up what the expectations are for those people that are getting the vaccine. And then yesterday, Governor Newsom actually had 2 press conferences. So the first press conference was basically to talk about, an update on fatalities, and from a December standpoint, we've had over 5,700 fatalities here in California. So it's the deadliest month ever since the pandemic began in California. And the average number of deaths and cases, however, each day still continues to rise. So it continued to rise through the Christmas break, and depending upon whether or not people actually stayed at home, we'll see whether or not that's an issue or not. Governor Newsom also unveiled yesterday a big package, a $2 billion package of incentives for California school districts to reopen their classrooms for in-person instruction as early as, we'll say, mid-February. And so this was, several things. It was first a package to boost spending for testing, and weekly tests at schools. If it doesn't mandate testing, but it, of course, gives those schools with high rates of COVID-19 transmission, or to make sure that they're being safe, that ability and that foundation to actually do the testing that they need. And then, it was kind of laying the foundation or kind of the expectation. Schools and counties with, 7-day average of fewer than 28 new coronavirus cases daily per 100,000 residents could open. And so starting in mid-February, end of February, um, if your case count is 28 new COVID cases per day per 100,000, those schools could start opening. And that would, and to kind of put that in perspective, right now, Santa Clara County is reporting a 7-day average of about 67 cases per day. So about twice as many, as or more than twice as many per um, cases that are being reported a day than what would be required to actually start opening up the schools. So, and parents could still opt to continue distance learning if they're not comfortable with sending their students back into the classroom. And not every school will reopen, of course, but the governor noted that new funding will at least make it easier for those that want to open to actually reopen. So that's kind of a first step. And we'll have a whole new dashboard when schools start opening up on so that people can see the school's reopening status on a county by county basis, the level of available funding, and data on school outbreaks as far as coronavirus. So that was an important kind of first step, talking about what's happening with the schools, and I know that there are a lot of parents that are looking that they would like to see their kids get back to schools, and that funding is a critical part of that. And then the governor also actually had a second conference a few hours later, after announcing the funding for schools and kind of the general plan for opening up our schools. And this was a sit-down discussion with Dr. Fauci. So it was actually a really good video. I put it up on my Facebook page, so if you get a chance to watch that, it's very interesting, very educational. I think there's some good questions. They talked a lot about vaccines and kind of what the expectations are looking forward throughout the year, looking at herd immunity and what part of the summer, midsummer, late summer, that we'll finally have herd immunity and start being really able to open a lot of the events and getting back to a real normal. And then he talked, Dr. Fauci talked about vaccine availability, and his expectation was by April, anyone who wanted a vaccine would be able to get it. And so, that means that at least from what Dr. Fauci's seen, the numbers are the number of vaccines and vaccine doses being produced shows that by springtime we should be getting enough being produced that people are able to get vaccinated if they want to get vaccinated. So, and then California. Governor Newsom also talked about that, announced that the first variant, COVID-19 variant that was first seen in the UK, had now been seen in Southern California. So it had first been seen in Colorado a few days ago. So this is a new variant, and there's always mutations of the different viruses, but this COVID-19 variant that was seen in the UK last week was seen as a lot more transmittable. So it was a lot easier to transmit from person to person, and it was first seen in Colorado earlier this week, and then just yesterday they seen that same variant in Southern California. So, and it's not an easy time. At least Dr. Fauci said that the vaccine should also be applicable to the same variant, but it's not easy for anyone, and this only conceivably increases the number of people that are getting COVID-19. So be safe, do what you can. And it was a good discussion, and I thought it was good if you get a chance, take a look at it. It's about half an hour, 45 minutes. Let's go ahead and get to the county health dashboard and talk about what's happening at a state level. From a national standpoint, we're over, I think, 20 million cases now, and it's up about another 1.5 million. Um, from a California standpoint, we passed 2.25 million cases, and California's had just about 25,000 deaths, and an ICU bed availability is less than 1%, around the state on an average. So it's really difficult times, and from a county standpoint, things are still not looking good. We've had from a county standpoint, we've had 67,500 cases. That's up another 7,500 just from a week ago. And so we've seen that general 7,500 is kind of our new weekly number. So 7,500 new people are being positive, showing COVID-19 positive every week. And then we have about 712 COVID hospitalizations compared to 631 last week. So that continues to increase. So the number of people that are being hospitalized, both ICU and non-ICU, are a large percentage of those are related to COVID-19. And then from a city standpoint, San Jose continues to have the most. They're now at 44,000, over 44,000. That's about up 5,000 from last week at this time. So they're having about a 5,000 a week. And then even Sunnyvale, we're at 2,900 cases. We're going up about 400 cases every week. So it's around the county, it's around the state, it's around the U.S. that we're seeing so many people being affected, so many people testing positive of COVID-19, and dying and getting sick and dying. It's really bad, and I'm really worried to see what effects we've seen because of the holidays and people gathering and kind of disregarding a lot of the warnings, a lot of the warnings by the CDC that people shouldn't travel. That being said, this past few weeks have seen the most travel since COVID-19 began. And then as far as advocating, I continue to do a lot of advocating on your behalf. We didn't have as many meetings this past week, but I'll have more later this weekend. From a county level, as far as testing, we continue to have our pop-up van here in Murphy Park every second and fourth Monday. So that will be coming up a week and a half from now. So that will be that will be what is it? That's the 11th and the 25th. So that will be right here at Murphy Park. So if you go to sccfreetest.org, you can starting a week before those dates. So on the 4th, you can start signing up for the 11th, and the same thing is on the 18th. You can start signing up for the 25th. And if you go to sccfreetest.org, it'll also give you locations around the county where you can get tested. El Camino Hospital is also testing for those people in the El Camino Hospital district that live or work in the district. And then, there's multiple places in Mountain View, the Santa Clara County Fairgrounds. So there's lots of places that you can go and get tested if you want to get tested. And so just go to sccfreetest.org if you need to do that. Okay, so let's go ahead and announce some upcoming events. Tonight, of course, is New Year's Eve. Reminder that fireworks are legal, and hopefully we won't see as much fireworks as we had over the July 4th holiday. Next Tuesday is our first council meeting of the year, and it's mainly a lot of ceremony. It's recognition of our outgoing vice mayor and council members. It's recognition of our elected mayor and council members and re-elected council members, and the ceremonial oath of office. So it should be, definitely I'll put the link on the website, and for people who want to attend and hear some of those speeches. We'll also be selecting our vice mayor for the 1 year term. And so again, our vice mayor is selected by council as a 1 year term. And then we'll also appoint our council members to our intergovernmental assignments. And then we'll finally choose our seating assignments. So although we won't be meeting in person for a while yet. And you attend that meeting if you want. It'll all be done virtually, but from that standpoint, it's good to get back and welcome in our new council members, say goodbye to our exiting council members, and welcome in our new ones. Let's go ahead and get to the weekly questions. Didn't get many questions this week, but Olwen asked, my in-laws in Snail have those beautiful red bows up every year. Does Lowlanders have a kind of formal meeting, funding, activities, newsletter, or is it just Snail? So actually there are about 24 different neighborhood associations around the city. So depending upon where you live, there's possibly a neighborhood association. Lowlanders, they started up an association, and Lowlanders is the area just south of Maud to Central Expressway. So it's basically they started that as a neighborhood association about 1.5 years ago, and had their first few events. Then of course COVID happened, and not many people met. I know that there are still a few neighborhood associations that have been meeting under Zoom, but there hasn't been a lot of activity over the last year. As far as those red ribbons, the Snail neighborhood has been doing those for many years. And those, if you saw my have a question post from yesterday, those red ribbons are some of the ones around the neighborhood association, and those were funded by neighborhood grants, so that from a grant standpoint, different neighborhoods can do, usually for a national night out events. They have block parties, or they could have potlucks. They could do lots of different ideas that they've done in the past. So from that standpoint, it's important that it's trying to build community. And so the city does have funds that we basically help to fund neighborhoods getting together and promote unity amongst the different neighborhoods. So I'll reach out to the Lowlander, several of people that I know that were kicking off that neighborhood association, and see if they can actually have a meeting, because it would be good to start that regularly again. And I've had several people ask about the fences around City Hall. So construction will start very soon. This is, of course, the modernization of the City Hall and an addition onto the public safety building. So, this was approved. This has been a several-year process of evaluating the needs, looking at funding, and then kind of doing a final design. So that will be kicking off. So you see the fencing go up around there. They've started kind of tearing up the parking lot and looking at, building what a new city hall will be. And so that's, if you take a look at the city webpage, you can find, a location there to look at what's being done. And, it's a really an impressive LEED Platinum building, net zero. So it'll be, much more energy conscious. It'll have much better, seating, and be much better heated and cooled than the 50-year-old building that we're currently in. That's pretty much all the questions that I had for this week. Let's go ahead. I wanted to keep it short, and it looks like we still went 45 minutes, but let's go ahead and wrap up. Thanks for joining me again this week. I'll see you again next year. It's been a very difficult 2020, but I am really proud of Sunnyvale's response to the pandemic. I know it continues to be difficult, and new issues come up almost every day, but your actions and your response really does make a difference. So until next week, please, wear your mask, get a flu shot, do what you can to help your neighbors, share baked goods, celebrate remotely. But it's important, I'm really proud to see Sunnyvale residents pulling together, helping their neighbors and helping strangers for that matter. If you're out on your walk today, wave, say hello from a safe social distance. People miss that social interaction. That's one of the reasons why I think people enjoy coming to this on a weekly basis. Sunnyvale will emerge from this as a stronger community. We're in this together. We'll get through this together. So thanks for listening. Until next week, stay safe, stay warm. It'll be rainy, I think, coming tomorrow. Wear your mask, of course, and all the best to you and yours in 2021. Until next week, have a good time. Take care. Bye.